David, Christine, that's right. So while Providence has those temporary replacement workers, around 2,000 of them staffed and ready to go to keep up with patient demand, they said it will not be business as usual at these hospitals. In fact, Providence says the Oregon Nurses Association is responsible for any impacted care to patients, but the union is saying that they're not just doing this for themselves, but for their patients.
This strike could have been avoided. And frankly, there is still time, even at this 11th hour.
I think we feel terrible that it has come to this. Well, ONA has been kind of forecasting this, kind of historic strike since early fall.
Providence healthcare workers, represented by the Oregon Nurses Association, are ready to strike as soon as Friday morning.
The strike is about far more than just wages. It's about staffing, employee health care, patient care, and overall working conditions.
The union argues that Providence allows hospitals and clinics to be understaffed. However, Providence says that it is completely false. The strike would involve nearly 5,000 healthcare workers in the Providence healthcare system, potentially affecting thousands in need of medical care.
There is the intention of making sure we're being mindful and planful about safe staffing. And then there's the today reality when someone's called in sick or we're, in the middle of a surge of patients. And so, the best laid plans that we walk into and we plan for together can't always happen.
We are caring for a growing volume of patients with a shrinking professional staff.
3 women's clinics will be shutting down during the strike, with another having limited services. Providence also warned that it will limit patients at St. Vincent Hospital.
I worry that this is going to have impact. We have managed our previous strikes without impact to the community. This one includes providers. There is no replacement workforce for providers.
Physicians and nurses argue that great providers have left for better contracts to other nearby facilities, and if Providence wants to retain their workers, they need to meet their demands. They say it's not just for the benefit of nurses and doctors, but for patients' well-being as well.
We on the front lines are experiencing increasingly strained and dangerous working conditions. There has been a complete stagnation in our staffing strategy and the compensation models.
This strike set to affect 8 Providence hospitals and 6 Providence clinics. Now, while the nurses' strike is more widespread, as for physicians, only physicians coming out of Providence, St. Vincent, and the Providence Women's Clinics will be participating. And at that, it'll only be the hospitalists, OB hospitalists, and the palliative care physicians. Providence says they'll be in contact with any patients whose appointments need to be canceled. Back to you.
And it appears there is no end date for the strike either. Thanks, Celine. Appreciate the update.